Selamat siang, good afternoon. Welcome back to another Bali COVID-19 update. My name is Bruce, and this is December 26, 2021, and we're almost done with the year. If you were celebrating Christmas yesterday, I hope you had a good one. And coming up on New Year's, and it's going to be a quiet one here in Bali. Don't forget that at the end, for the wrap-up update, there are a few items that just came out this morning, and I haven't had time to go into them in detail, and I'll be talking a little bit about them at the end. So if you want to hear about that, you can either listen to this whole thing or you can just jump over to the end. Well, in the spirit of the holidays, I'm trying to stay as upbeat as possible. Just thinking about things, there's been over 5.5 million people that have died from COVID since this thing started. I'm not one on the blessings thing, but yeah, we can count our good fortune, our blessings, whatever you want to call it, if we're still around, if our family and friends are still around. So let's try not to be too negative about things. I'm happy to be here, happy to be alive, happy to be doing this. So I hope you are too. And let's take a look at the numbers, because there's some good news there. The 7-day average for new positive cases is still at 4, so remaining stable, and the 7-day average for deaths, 0.3. So good news in that it's stable, and that's what we want. We don't want it to go up, and that's what the government's been worrying about. Of course, we're not through the holiday season yet. Still remains to be seen what's going to happen, but the numbers right now are good. And what about new positive cases in Indonesia? 255 yesterday. Deaths down to 6. Okay, so our numbers are some of the best in the world. We should be really happy. And what about testing? Total individuals tested yesterday, 149,285 with a 0.17 positive rate, and the 7-day simple average positivity rate, 0.11. And so we're looking good. And we got some numbers on Bali testing. Bali testing over the last 7 days, 46,392. The 7-day positivity rate was 0.06. Okay. And what about those vaccination numbers? Vaccinations, first dose, 3,485,561, 78% of the population, that's the total population, has been vaccinated one time at least. Second dose, 3,091,597, 69.2% of the population has been vaccinated, well, fully vaccinated, although those vaccines may be wearing out. That's going to be a problem, and we're going to talk about boosters in a minute. And yesterday, only 457 additional doses yesterday, maybe because of Christmas. And what about cases in Bali yesterday? New cases in Bali yesterday, 7. Deaths, 0, hooray, and active cases down to 55. The numbers are looking good. They're stable, and that's what we want. We're still in 10-day quarantine, and there's no new restrictions since the last video on Wednesday, but let's take a look and see what the government's thinking about right now. As of today, as of this minute today, things are the same in terms of curbs and restrictions, but Indonesia weighs tougher curbs in response to Omicron. The government said that certain conditions have to be met before restrictions will be tightened in response to the highly contagious Omicron COVID-19 variant. Pak Luhut said the government is continuing to monitor the situation and the latest developments, and that it is prepared contingency measures if certain conditions are met. And what are those conditions? He said we will start to gradually tighten curbs if case numbers pass 500 cases per day, 1,000 cases per day. Pak Luhut said further restrictions would be introduced if case figures pass the government's threshold of 2,700 a day, equivalent to 10 cases per million people. And Pak Luhut, as everybody else these days, says please don't travel in light of the Omicron variant, Omicron variant, Omicron variant. God, will I ever get this right? Adding that the government was mulling whether to increase the mandatory quarantine from 10 to 14 days. And so that still hasn't happened, and it's still on the table. According to Ibu Mastalina of the Indonesian Epidemiologist Association, the government focus on enacting measures at a more local level is the best, as opposed to doing it on a nationwide level, so not one size fits all. She said this is in order to limit the spread of the Omicron variant. She said the government could start imposing its emergency measures when local transmissions of the variant were confirmed, when cases in certain cities or regions more than doubled, when the positivity rate in certain areas increases to more than 5%, then it's time to do something. What's the situation with Omicron in Indonesia right now? 11 new Omicron cases added. People asked not to travel. Of course, asked not to travel. So the Ministry of Health has added another 11 new cases of the Omicron variant in Indonesia, which pushes us up to 19 now. The 11 new cases originated from international travelers who came into Indonesia from Turkey, Japan, South Korea, and Saudi Arabia. Currently, all of them are in quarantine in Jakarta. So far, the cases are international arrivals. Well, the first case wasn't an international arrival. He hadn't been out of the country, but he was working in the quarantine facility in Jakarta. So at this point, Saturday afternoon, there are no reported cases of the Omicron variant spread locally. Does that mean that there isn't? No, it doesn't mean that at all. It just means that it hasn't been found yet. Spokesperson for the Ministry of Health COVID-19 vaccination, Dr. Siti Nadia Tirmizi, mentioned her many times now, said the findings of the Omicron cases of the state gates show the results of strengthening surveillance and increasing WGS examinations, especially for patients from travelers who are confirmed positive, so that the treatment steps can be taken quickly. And like everybody else, Dr. Nadia appealed to the public to remain vigilant for spreading the Omicron variant and to delay travel abroad and to follow all the health protocols. She said, self-awareness, not travel first, must be done, especially in the midst of Christmas and New Year holidays. It's important for us to take care of each other. We should all remember that. And there's so much on Omicron now that, well, I'm only going to talk about a couple of stories because everything changes day by day. So for today's video, I picked out a couple of stories that, well, have some promise. Steps taken to target Omicron with AstraZeneca jab, scientists say. Sandy Douglas, a research group leader at Oxford, told the Financial Times that an updated vaccine could be used to respond to any new variant more rapidly than previously believed. Okay, that's good news. She said adenovirus-based vaccines, such as the one made by AstraZeneca, could in principle be used to respond to any new variant more rapidly than some may previously have realized. Researchers at Imperial College in London published a study last week that indicates that a booster shot could provide up to 80% protection against the Omicron variant. The modeling, which involved both AstraZeneca and Pfizer vaccines, showed vaccine effectiveness between 0 and 20% after 2 doses. What? That's me. I've had 2 doses of AZ. And between 55 and 80% after a booster. But this study was based on limited information on Omicron. So all of these studies you have to be careful about right now because a lot of them are based on limited information. Imperial researcher Professor Azra Ghani said, one remaining uncertainty is how severe the disease caused by Omicron variant is compared to disease by previous variants. And that is the big question still. How severe is this? A lot of people are saying, okay, it's less severe, but the final results haven't come in yet. Early results are promising in terms of the severity. According to Professor Ghani, prioritizing these boosters to high-risk populations over primary vaccination in younger age groups should be part of the response in countries where dose supply is limited. A recent analysis by UK's Health Security Agency indicates that a booster offers significantly improved protection against symptomatic infection from the new variant when compared with just 2 doses. The analysis shows that both AstraZeneca and Pfizer provide much lower levels of protection against symptomatic infection from Omicron than Delta, making the double jab vulnerable to the variant. And in a study published in The Lancet, and The Lancet is a world-famous medical journal, in case you don't know, researchers found that protection afforded by 2 doses of AstraZeneca began to wane after 3 months. However, when the study was done, Omicron was not around. Researchers behind the findings wrote that waning vaccine protection against COVID-19 hospitalization admissions and deaths in both Scotland and Brazil are becoming evident within 3 months of the second vaccine dose. And more on Omicron and vaccines. U.S. Army creates single vaccine against all COVID and SARS variants, researchers say. Now, this is promising. So within weeks, scientists at the Walter Reed Army Institute of Research expect to announce that they developed a vaccine that's effective against COVID-19 and all of its variants, even Omicron, as well as all previous SARS origin viruses that have killed millions of people worldwide. Is this one of those studies that's been rushed out and done quickly? No. This study has been going on for 2 years. The Army lab received its first DNA sequencing of the COVID virus in early 2020. From very early on, Walter Reed's infectious disease branch decided to focus on making a vaccine that would work against not just the existing strain, but potential variants as well. Okay, they were thinking ahead. So what is this called? Oh, this has got a funky name. Walter Reed Spike Ferritin Nanoparticle COVID-19 Vaccine, or SPFN, completed animal trials earlier this year with positive results. Phase 1 of human trials just wrapped up, again with positive results that are undergoing final review. So the new vaccine will still need to go through Phase 2 and Phase 3 trials. According to Dr. Kayvan Mojarrad, director of Walter Reed's Infectious Diseases branch, we're testing our vaccine against all the different variants, including Omicron. He said, we want to wait for those clinical data to be able to make the kind of full public announcements, but so far, everything has been moving along exactly as we had hoped. The vaccine human trials took longer than expected, he said, because the lab needed to test the vaccine on subjects who had neither been vaccinated nor previously infected with COVID. Increasing vaccination rates and the rapid spread of the Omicron variants made that difficult. Now, this is interesting. I've heard this before, not from a doctor yet. With Omicron, there's no way really to escape this virus. You're not going to be able to avoid it. So I think pretty soon either the whole world will be vaccinated or have been infected. So then the next step is to see how the new pan-coronavirus vaccine interacts with people who were previously vaccinated or were sick. Walter Reed is working with a yet-to-be-named industry partner for a wider rollout. According to Professor Ghani, we need to evaluate it in a real-world setting and try to understand how does a vaccine perform in much larger numbers of individuals who've already been vaccinated with something else initially or already been sick. What were they thinking about when they started this research? According to Professor Ghani, we decided to take a look at the long game rather than just focusing on the original emergence of SARS, and instead understand that viruses mutate. There will be variants that emerge, future viruses that may emerge in terms of new species. Our platform and approach will equip people to be prepared for that. Wow. Now this is good. You know, this phrase, game changer, has been used so often, but here is something that could possibly be a game changer, and I hate to use that, but if there is a vaccine that is going to be effective against all of the variants, wow. And what's happening with the vaccines and vaccinations of our children? 25,000 kids aged 6 to 11 vaccinated per day in Bali as province aims to complete first round this month. Okay, good news. So 25,000 kids per day are being vaccinated. That's a good rate, but it's below the targeted rate. The targeted rate was 40,000 a day, or is 40,000 a day, and that's in order to complete the first round, which is 373,120 Balinese children before the end of the year. Got a lot of kids in Bali. I've got about half of them in my house, I think, right now, with both grandkids here and their friends. The Bali Health Agency said as of December 21st, 108,204 people in the youngest age group have received their first shot since the program launched on December 15th. Good news. And Bali Health Agency head Ikutut Swarjaya, and I've talked about him many times, said that the rate of 25,000, while below the targeted rate, is still really high. And he said the province intends on speeding up the vaccination rate in order to meet the goal but it may face a shortage of the Sinovac vaccine, the only vaccine approved for use of the age group on the island. However, he added that 100,000 doses of the vaccine have been shipped to Bali and are expected to arrive. Well, they should have already arrived. They should have already arrived by the time I am doing this on Sunday. And the good doctor noted that the central government has been quick to fill potential gaps in the island's vaccine supply. And across all age groups, Bali has one of the highest vaccination rates in Indonesia, as we all know. And thank goodness for that. I mentioned in the numbers segment that the vaccine could be waning, and well, new research is showing that, yeah, they do wane and that they're less effective, especially against the Omicron variant. Well, COVID-19 booster vaccine available to public from January 4th. We've got a firm date from the minister, the Home Affairs Minister, Pak Tito. The booster will be available under two schemes. The first, the free booster vaccines will be offered to residents registered as beneficiary recipients, and residents not eligible to receive the free doses will be able to purchase the vaccine at an affordable price. What's the affordable price? The government hasn't decided yet, but they will announce it soon. And remember, I don't know, 5-6 videos ago, a number of 300,000 was floated out. And so we'll see how that works out. And what about some news from Thailand? COVID infections surge among new arrivals. Not good news for everybody that is hoping for good things in Thailand so that there'll be good things in their own countries. Thailand logged 2,940 new COVID cases in 30 more facilities during the previous 24 hours. That was on Thursday. The Center for COVID-19 Situation Administration, CCSA, I've talked about them before, said that new cases among people who flew into the country since it was reopened had surged over the past few days. Infections among arrivals under recently suspended quarantine waiver program Test and Go rose from 22 on Monday to 35 on Wednesday, while new cases under the quarantine scheme jumped from 2 on Tuesday to 15 on Wednesday. So cases are going up. And this is Omicron. Travelers from the UK registered with the most infections at 78, the US 62, Russia 35, Germany and France 25 each. This is from the period of December 1st to December 22nd. So, bad news if you're a traveler. And more on Thailand. Israeli breakout blamed on apps. Okay, and apparently an Israeli tourist escaped quarantine, and the government is blaming it on the apps. The failure to synchronize a tourist tracking system is the main reason some tourists have been able to avoid the health screening process. As what happened with the Israeli tourist who ran away from his hotel in Bangkok. Okay, I just visualize this guy running away. Okay, you need to laugh about this stuff. It can get so depressing if you don't laugh about it. According to the president of the Katakarang Hotel Association, different authorities responsible for different applications are not working to synchronize their apps into a whole system. She said the recent case of the Israeli tourist who ran away from the Bangkok hotel should be a case study of our preventive measures. She said that more than 80% of inbound travelers could not download the Morchana app, which is supposed to be the main tool to track the whereabouts and alert them to take a second COVID test or when they've had close contact with COVID patients. 80%. Okay, people complaining about our app? Wow, 80%. She said the country uses 3 apps, including Thailand Pass, the pre-arrival registration system that should link with COSTE, the surveillance platform the disease control department requires hotels use for all guest bookings and other information. However, she said, when the wrong name or passport number during the process is entered, the app does not synchronize, resulting in unsuccessful Morchana download for that individual. She continued, as the Omicron variant poses a new threat, state agencies responsible for these apps must urgently fix the system so the apps synchronize to strengthen safety measures. So when the system malfunctions, the hotels are responsible for inputting all this data manually. which some hotels are doing and other hotels are not doing. According to the president of Thai Hotels Association's Southern Chapter, Mr. Suksit, hotel workers currently assist tourists case by case, which not only prolongs the check-in process to almost an hour, oh fun, but also increases the risk of getting an infection. He said hoteliers manually solve problems now instead of capitalizing on technology to ensure all guests are tracked and freed from the disease. He said hotels have to print out QR codes and let the guests keep a copy if they're unable to install more China. And so travel, right? Everybody wants to travel, and one of my favorite airlines was, believe it or not, Garuda. I love Garuda. I took Garuda internationally. I've taken Garuda domestically. One of my best flights was an old flight, way back when Garuda used to fly to the United States before the world economic collapse in 1998. Well, bad news, Garuda to fly only 5 international routes in 2022. So why? Well, Garuda's been on the edge of bankruptcy for a number of years now, and so it's slashing its international network to just 5 routes, abandoning Europe and much of Asia in order to try to see a profit. What are the international destinations that Garuda will be servicing? Sydney, Hong Kong, Tokyo, Seoul, and a yet-to-be-determined city in China. Okay, well, I would like to go to Tokyo or Seoul, so that's kind of good news for me. Well, if the pandemic ever ends. According to the president-director of Garuda International, experience teaches that the most appropriate approach to operate aircraft on profitable routes. Right, well, okay, you want to operate an aircraft on profitable routes, slowly opening other routes and increasing the frequency. And he added that there are plans to recommence flights to Jeddah, including the Umrah pilgrimage, pending government confirmation of travel requirements. Why is Garuda in such bad shape financially? The impact of corruption in the procurement of aircraft and engines, aggressive fleet expansion, and high costs contributed to the annual net losses since 2017. 4 years of losses. From January 2022, Garuda will enter a code-share alliance with Emirates, covering some 18 international routes in Europe, Africa, the Americas, and the Middle East, with both airlines exploring opportunities to cooperate on their respective frequent flyer programs to enable customers of both airlines to earn and redeem loyalty points for reward tickets, upgrades, and other exclusive benefits. Okay. And so what's happening here with hotels and quarantine? This is a good one. Hotels for quarantine and holidaying should be separate task force. The head of the Health Handling Division of the COVID-19 Task Force, Alexandra Ginting, emphasized that those who are quarantined cannot stay at the same location as those who are having a holiday. And they have to have a place that's got a separate entrance. And this does not mean, he said, that they can't stay in the same hotel. They can, but they have to have a separate entrance. And what does that mean? Well, Ginton explained that if the hotel only had one main building and one door to the entrance, then it suggested that it be used just as a quarantine hotel. Or if the hotel had several buildings, such as a right wing and a left wing, then it might be considered to function as a quarantine and a holiday hotel both, as long as it has 2 separate entrances, 2 separate buildings. It can be used multifunction, let's say. However, he noted that the public must understand that hotels may serve for quarantine only or be assigned as a regular hotel as well. Please check the buildings, whether they have only one entrance or multiple entrances. So that's if you're going on holiday. If you're being quarantined, that's a different story because you have a limited number of places that you can stay. You have to pick a place off the quarantine list. And the coordinator of the expert team and spokesperson for the government's COVID-19 handling, Wiku Adesasmito, stated that to support the prevention of COVID-19 transmission, quarantine facility managers must provide health facilities that comply with standards. And what are these standards? Well, disinfection, routine maintenance of cleanliness in the vicinity. In addition, the hotel management assigned as a quarantine facility must provide regular health checks, especially for high-risk populations. This includes providing an information hotline with a quick response and conducting quarantine surveillance. If you're holidaying in Jakarta, you're going to want to check the hotel that you're staying at. Is that a quarantine hotel? And if it is, to have separate buildings that have separate entrances. So let the buyer beware. So what's the situation here in Bali with tourism and hotels and everything, the demonstrations that aren't going to happen anymore, and international arrivals? Well, the governor has made an announcement. 25,000 domestic travelers arrive in Bali each day, according to Governor Koster. The Bali provincial government says it wants to focus on reaping the rewards from an influx of domestic tourists for Christmas and New Year's, and Christmas was yesterday, and so now we're looking at New Year's. After international tourists continue to shun the holiday island. I like that word, shun the holiday island. Governor Koster yesterday called on the provincial government and tourism players to momentarily put aside efforts to revive international tourism and focus on what's happening right in front of you. Specifically, an average of 25,000 tourists a day arriving in Bali from other parts of Indonesia. So he's saying focus on what we've got, not on what we don't have. Is that going to make people happy? Some maybe, others probably not. But look, that's what we've got. We've got domestic tourists, so I agree with we should focus on it. He said the domestic market is huge. They're more loyal even. Don't focus on international tourists. They're more loyal even. What does that mean? But you notice that he said 25,000 tourists a day are arriving, so not 20. I like that. The governor said with many domestic flights to Bali fully booked, he's appealing to the central government via Tourism Minister Pak Sandiaga Uno to allow more flights into the island. Right? We want domestic tourists coming in. We have no idea what's going on with the Omicron variant in Java as it spread around. Now there's a story here that I haven't mentioned, and I may put this in or not, from an epidemiologist who said, hey, it's already here. We just don't know it yet. I don't know. There's a lot of questions, and we're going to just have to wait over the next few weeks, like everybody else in the world. And the governor concluded when the pandemic situation is better, international tourists will come without an invitation. What about the PL app, right? So much about the PL app, and I've talked about it a lot, and I have it here, and mine's working. Oops, utilization of the Care Protect application is starting to slack. So that's what this is called when you translate it into English through Google. The Care Protect app, otherwise known as Peduli Lindungi. So not only in public spaces, the same thing happens in government agencies and educational institutions, according to a team from the Bulalang COVID-19 task force. So the task force went out monitoring the situation and the use of the app, and they went to a variety of locations this past week. And on Monday, the team conducted monitoring of government institutions. When it was monitoring, it found out that the use of the PL app was not always optimal. So the number of employees who were in the room were more than the people that checked in using the app. So some people did not use the app. It should be pretty easy to figure out who they are. And on Tuesday, the team evaluated a number of green open spaces and tourist objects in Bulalang, and the result was the same. The team even found that in some locations, no one was checking in. Of course, as I've mentioned before, okay, this is implementation, carrying out things. The spokesperson for the Bulalang COVID-19 Handling Task Force, Ketut Suwarmawan, said that in general the community had actually been disciplined in implementing health protocols, but not with Peduli Lindungi. And he asked for public awareness in using this app. He said the application is important as a monitoring and prevention measure. So if someone is confirmed positive but doesn't quarantine, we'll know about it. We'll be monitored. Or if we have contact with people who are confirmed positive in the same public facilities, the task force can track them more easily. Some more on what's happening in Bali. All services to crossing Nusa to Penida, second vaccine mandatory. So you remember when the vaccination started and there was some hesitancy, and different regencies were saying, okay, you don't want to get vaccinated, fine, but don't come to us for services. Well, now in Nusa Penida, you need to get a second vaccination. And if you don't, forget the services. So the coverage of the second dose of COVID-19 vaccination Nusa Penida district is relatively low. In order to increase the coverage, residents who need services in the sub-district office and crossing to and from Nusa Penida will be required to show evidence of having been vaccinated against COVID-19 on the second dose. The sub-district head of Nusa Penida, Ikomang Widyasa Putra, said that the coverage of first dose in Nusa Penida is about 83%. Okay, not bad, of the total targeted vaccination. Oh, so it's a lot less than the total. And the coverage of the second dose is around 63%. And according to the sub-district head, since Nusa Penida is a tourist area and mobility in and out of tourist areas is quite high, the risk of COVID-19 transmission is also high. And so he said community immunity must be realized immediately. Okay, and some more on bullying, and this is cool, and, well, it shows how lazy I am, too. Rooftop creative space to be established at Pasar Banyuasri. So Pasar Banyuasri is that big new one, well, it's not new anymore, that is over to the west of us. And I keep meaning to go there, and I haven't. I have flown my drone over there several times and got some nice video. And, well, that's a way. The drone was, that drone went a long way. And with the wind, we just haven't been able to do that. But anyway, what about this? Rooftop creative space, what does that mean? So the creative economy of the younger generation in Buluang Regency has become a priority aspect to be developed. Therefore, the Regency government plans to establish a rooftop creative space, otherwise called RSC, by utilizing the market parking lot, which is located on the third floor of the structure. Okay, that's a huge structure, and I am going to get there maybe this week. According to the head of the Buluang Tourism Office, Pakade Dodi, they've received full cooperation from the Regent's office, and this is in line with showing all the positive original local products being created here. And so the governor talked about that, well, a long time ago, when there's somewhere in the archives there is a video about that, because Buluang gets, well, forgotten a lot of times. So we're way up here in the north. A lot of people don't like to make the drive up here. There's no white sand beaches, etc., etc. And so the Regent has been trying to stress the coolness of Buluang, and Buluang is cool. Don't move up here, though. We've got plenty of people. So the goal for creating this new space is to activate the Banyuasri market so that it becomes a soybean destination. Pak Dodi said that the RSC is planned to be completed in January 22 and will be equipped with various facilities such as a culinary UKM kiosk, staging stages, workshop rooms, and a skate park. Wow, okay. And everything is managed by the Creative Economy Committee, Kabupaten Buluang, and synergized with related regional apparatus and communities who are members of the Creative Economy community. So in addition to using the top floor there, the third floor, for all of these cool things, the stages, the workshop rooms, the skate park, there's also going to be several places that small, medium enterprises can use to showcase and sell their products. There's 8 kiosks that have not been utilized yet, and so they are looking for people to utilize those. And so this is a cool thing, and really, I've got to push myself to go there this week. And let's see, if I don't have something up in another week or so, ask me why. Make a comment. Time for wrap-up update. Okay, and what do we have? Let's take a look first. Singapore. Singapore travelers face Omicron chaos. Now, this was an opinion piece in the Straits Times, I think, and talking about separation threatens parents and children. Total strangers share quarantine rooms, and hospital bills are climbing. The financial hub's reputation for pandemic management is taking a beating. And why is this? Well, it's because the government announced new travel restrictions to manage the spread of the Omicron variant. And, well, they have apparently not been doing a great job right now. So, according to this opinion piece, residents who have returned this month from travel abroad are describing situations where they've been forced from their homes, ordered to share quarantine facilities with complete strangers, told to hand their unsupervised children off to authorities, and urged to abandon their pets. Oh my God. And some now face hefty hospital bills because of problems with their insurance. Okay, making fun of abandoning the pets, but yeah, it's a serious thing. You don't want to leave your pets to die. 2 videos ago, I was talking about what a great job Singapore was doing in preparing for the Omicron variant. It seems like they've run into some snags, so I'm going to keep an eye on this story as this develops. And still on Singapore, 448 Omicron COVID-19 cases detected in Singapore to date. New cluster linked to bar on River Valley Road. Okay, and so they're getting more cases of Omicron in Singapore, which may be why they're kind of fumbling the ball here in working, getting a little panicky maybe. And Singapore has frozen all new ticket sales for VTL flights and buses until January 20th, 22 because of the rapid spread of Omicron in many countries. And Singapore has VTLs with more than 20 countries and regions, including Indonesia and Australia, because I know a lot of people watch this and live in Australia. And what about Thailand? Okay, Thailand reports first Omicron cluster. So this story, this was an update last night and then an update this morning to increase this. So this cluster, according to this, and this was up in the Koster province in northeastern Thailand, the cluster was 21 people and is supposedly spread by 2 Belgians who came in through the country's test and go scheme. But according to a report that's just come out in the Bangkok Post, it's not sure that it's the Belgians, that Belgian citizens or people just came from Belgium, so that is not sure yet. So don't not put any blame on anybody. And the number, instead of 21, is now 60. And so this thing just spreads. And that's the reason why the government here has been taking things really, really cautiously. And last video, I think, I mentioned that 3 more countries were banned, Denmark, Norway, and what was the other one? I forget right now. But there's been no SE on those, so it's not official yet. I don't know why it's taken so long to do that. Well, it's not unusual. And the 14-day quarantine is still under consideration, and there may be something coming out tomorrow. You know, the government likes to release information on Monday evenings, and they're kind of online reports. Let's see what's going to happen with the quarantine, and will there be an SE released about the 3 countries being banned, an update here so they're on the red list or black list? Okay, I don't know. If you like birds, you would love being here. These guys are really noisy. Okay, so that's the update, and what's the wrap up? Let's do it short and sweet. The numbers are great still. We're holding steady. There's tourists coming in, domestic tourists are coming in, and businesses are getting a bump. It's not massive, but it's a bump. It's good news, and any business is better than no business. The weather is still funky. It's just pours all of a sudden. Last night it just like came out of nowhere and just wow, massive storm. And people were out fixing their roofs today because of the wind here on the sea. And so all in all, I'm cautiously optimistically pumped, okay? Why? Because, I don't know. My kids are all here. They've just shown up, not all of them, but 3 of them just showed up, and another one just messaged me and said he's trying to get here for New Year's Eve, and another one's just left, and some others were supposed to show up here, but they've been delayed by business in Jakarta. And so, you know, I've got the family here, and the weather is, not too bad. You know, I've often said that this isn't a paradise. It just drives me crazy when people say, oh, it's a paradise. It's not. It's a beautiful island. But, yeah, today's just one of those days that I just feel just lucky to be here. And so I hope you're feeling the same way. Thanks for viewing. If you found this helpful or amusing, please give it a thumbs up. And if you haven't subscribed, consider subscribing. Be kind to someone today. Thanks for viewing and stay safe. And I will see you on Wednesday.